Afternoon, Carroll County. This is Commissioner Ed Rothsey. I'm joined, very fortunately, with our Health Department lead, Mr. Ed Singer. Sometimes they say two Eds are better than one, but I'm not sure about this time. But the intent here is to answer your questions, share with you how we see the environment here in Carroll County today, and how we're going to move forward. Starting off with some good news, if you had not seen our governor's press conference this afternoon, he did announce the opening of retail and restaurants and facilities across the state. As we do here in Carroll County, we adhere to the governor's guidelines and direction, and we'll be moving forward with that. In addition, during open session on Thursday, I'll be joined with my fellow commissioners to discuss this further, and if there's any more specified tasks or direction to be provided, we will do that as well. The other piece that the governor said that I want to really highlight is although we're moving forward, there's still a pandemic, and we still have a long ways to go. We must continue to wear our masks. We must continue to wash our hands and keep social distancing. These are not options in public facilities. These are not options when we're directed to do so, like in grocery stores. I believe we're going to get there where this will no longer be the norm, but we still have a ways to go. That's not going to be the conversation for this evening. It is going to be focused on vaccines. I had a very good conversation with Acting Secretary Dennis Schrader last night, and I was joined by Senator Hester, Senator Reedy, Delegate Krebs, and Delegate Rose, along with the Secretary's team, to talk about the distribution of vaccinations and where the doses are going across Maryland. And I asked him to have this meeting because I had been frustrated, and I think I'm stealing Ed's word from I saw this morning, with how the allocation has been so far, and to get some clarity and transparency on the distribution of the vaccines across Maryland. And I also want to focus a lot of my attention to the Secretary that nobody knows Carroll Countyans better than Carroll Countyans. We say in the military that nobody knows the area better than the commander on the ground, and that's what I was trying to share with him as well and his team. Not sure if it's going to go in any specific direction, but I'm going to be persistent and consistent with that message. It's not about comparing ourselves to other jurisdictions or other counties. It's about taking care of Carroll Countyans, those most vulnerable, those that we have been targeting to get vaccines into their arms, allowing them to be with family, allowing them to hold their grandchildren or their children once again, not looking over their shoulder or being in fear of either getting sick themselves or passing it on to someone else. I have a list of questions that have been given to me from you. Also, it's an opportunity for you to ask questions, and I know there's an area on the site for you to be able to ask questions. We will gather those as well as questions come in to highlight and to ask. The intent here is to ask questions to both Mr. Singer and or myself. We will choose which one of us can answer that question best. I have a feeling it's going to be Mr. Singer for about 75% or more, because that's really where the focus is this evening on vaccines and doses. I saw a handful that I think I can also add a little bit of light to. So those are my opening comments. With that, what I'd like to do is allow Mr. Singer to open it up, and then I will facilitate this by asking some of the questions to him, or asking the questions and then building a dialogue from there. So Ed, it's yours.
Thank you, Commissioner. I really appreciate this opportunity to reach out and let folks in Carroll County know what's happening, and to have this town hall. It's something I've been wanting to do, and to be able to share with the community and get some immediate feedback is a great opportunity. The Commissioner mentioned some of the good news, that some things are moving in a positive direction, and he emphasized the need that we continue to wear masks. Talking about people getting vaccinated and some of the good news with that, it's nice to see when we're vaccinating people who are older, that are in their 70s and 80s, that they're happy that they're going to be able to feel a little more comfortable seeing their grandkids and other family members now that they're protected with a vaccine. And there's actually some CDC guidance that came out regarding risk and that type of thing. And if two people were vaccinated, then essentially they could be together and wouldn't have to social distance. Those kind of things are good news. And as we get more and more people vaccinated, less and less people will have to have social distancing and masks between them. But the important thing to remember is even as we move along with the CDC guidance and that type of thing, the governor's executive orders still apply to everybody, regardless of whether you've been vaccinated or not. And if you go out into a public place and you're required to wear a mask, it doesn't matter that you've been vaccinated. You still have to wear the mask. There's no easy way to identify who that person is that's been vaccinated or not. So it's important that we continue to all work for the good of our community and make sure that we're following the rules equally, even though some of us have had the opportunity to be vaccinated and some haven't. I do want to just start off briefly with a little bit about my whole philosophy on how we've been rolling out the vaccine in Carroll County from the health department standpoint, and that is we haven't been getting as many doses as we would like. We have a lot more capacity to be able to vaccinate a lot more people if we were getting more vaccine. But the commissioner's been advocating for us, and I've been advocating for us here in Carroll County, trying to get more doses, but we don't have control over that, and that we're going to make the best use of the doses that we're getting. So there's a reason that these priority groups were established by the federal government and by CDC, the phase 1A, 1B, and 1C, and it's because certain occupations are at high risk and could cause a high risk of transmission in our community, and certain people are certainly more vulnerable to getting sick or potentially dying from COVID-19. So we've really been focused on our highest priority groups, and we're using what I would consider to be the very limited amount of vaccine that we're getting to best reach the people who are most vulnerable and to keep the spread of the virus to a minimum in Carroll County. So there's a reason, again, that people are in 1A, 1B, and 1C, and we're going to get to you when it's your turn. And I think we started off when we got our first 100 doses of vaccine in December. I said to people, when it's your turn, get vaccinated. But there's a limited supply, and everybody's going to have to wait their turn. And we're going by these priority groups, and we're going to best reach our population and those who are most vulnerable first.
Ed and I are both retired military, and we're focused on leadership and not the politics. Sometimes I feel like there's a conflict between leadership and politics, but tonight the focus is on leadership. And on leadership, it's identifying the good, the bad, the ugly. The good is what's going well. The bad is what's not going so well. And the ugly is it may be going okay, but we could be more efficient at doing that. I'd like to start off with a good note. And I saw this in the Carroll County Times, and it's kudos to the health department. Don't know if Ed saw this or not. But kudos to Carroll County Health Department for outstanding service delivering COVID-19 vaccinations to the community. A health department member helped my wife navigate a stubborn online registration procedure. The inoculations were seamless and administered by a very professional staff at the South Carroll Senior Center. And I've heard nothing but very positive remarks on the professionalism of the staffs, whether it's from the health department, our nurses, all those on the front line, whether the vaccinations or the testing. So I really do applaud. And I think that, again, is a testament to Carroll County on just how good we are. Most of the questions I'm going to be asking now are going to focus now on the bad and some on the ugly, and that's okay. And let me just start off. Chris from Westminster asked, when can I get vaccinated? I'm 76 years old and I'm still waiting.
So I guess I'll address this by trying to let you know. You're definitely in the highest priority group of people that we want to reach right now. So we've reached 8,017 as of today. People who are over 75 in Carroll County have been vaccinated. We've been making phone calls. We know a lot of people don't have technology. Between our Citizen Services Department here in the county, and health department staff and other community partners, we've been reaching out to everybody who's over 75. But I'll tell you, we're getting to that point where some of the people are really hard to reach. We've left, we've called and left messages 6 or 7 times with some people. And I want to tell you that if you're over the age of 75, what we want you to do right now is to call us. We've had people on the interest list. Call our call center, 410-876-4848. Tell them that you're over 75 and that you need to make an appointment for a vaccination. We have clinics scheduled this Thursday in Eldersburg down at the South Carroll Senior Center for people who are over 75. I have a clinic next week in Westminster scheduled for people who are over 75. And we have 2 clinics the following week, one at the Hampstead, the North Carroll Senior Center, and one down at the Mount Airy Middle School for people who are over 75. Now we're going to fill those with people. We're starting to get into 1C, and our priority will be in 1C the people who are 65 to 74 because I feel like they're most at risk. We'll fill these clinics out with people that are 65 to 74. But if you're over 75, please call us, 410-876-4848, and we'll get somebody to help you schedule an appointment because we don't want anybody to have missed an opportunity to get vaccinated. And we've got about 3,200 or so people who are over 75 in Carroll County who still need to be vaccinated. I understand some people might be hesitant to get vaccinated. I would encourage everybody, because you're in a high-risk group, if you're over 75, please get vaccinated. But just call us, reach out, we'll get you scheduled.
You know, one thing that you don't see on the video is Ed and I are 6 feet apart, and there's actually 2 plexiglass windows between us. I am very proud of the team here in the county government on how they set up the dais to allow us to move again in a direction towards normalcy. But if you don't see the rest of the room, there's no one else in here except Mr. Chris Swam, who's doing the technology for us. So we are doing the best we can to safeguard ourselves. Olivia from Woodbine, a very similar question. She's helping the 84-year-old neighbor get her vaccine. I have completed an interest form for her this week. When can she expect to receive an appointment?
So I actually, one of my staff told me that apparently Olivia's person is scheduled for this week. So we're good to go. And again, if you're trying to help somebody who's over 75, make the phone call. We'll do our best to get them scheduled. We have a lot of people who are looking to help people. It doesn't take a very long amount of time, but we know without technology it's not easy. And the other thing that I'm very careful of is making sure that we get the right people in our clinics, because we have a very targeted approach of trying to reach those most vulnerable people that we want to be able to help.
Now going into another category, Mary, who's 57 from New Windsor. When and where are we able to sign up for the COVID vaccine through the health department?
So it's a tough one, but the answer is, you know, from what I said from the very beginning, I want everybody to get vaccinated, but I want you to get vaccinated when it's your turn. And there's 2 different categories that fall in here, and you could wind up in phase 2 or phase 3 depending on how healthy you are. If you're under the age of 65, regardless of what your underlying health conditions are, you're not until phase 2. And we've been encouraging people who have serious underlying health conditions to talk with their doctor and try to figure out if they can get prioritized through the hospital system and work with their physician. Some of the physicians' offices are going to start receiving vaccine, and you need to get prioritized if you have serious health conditions. If you're under 65 and relatively healthy, it may be a while before the vaccine supply catches up and you're able to get a vaccine. I've heard the president say that he's hopeful that anybody in America that wants to be able to get a shot will be able to do so by May. I would think that might be a little bit overly optimistic, and I would hope by at least summertime that we could get the majority of people who want to be vaccinated. But if you're 57 years old and you don't have underlying health conditions, you're pointing the cues pretty far down. You can get on an interest list, but you're not in a priority group, and it's going to be a while before we can get to you.
And we have roughly 168 to 170,000 in Carroll County. And out of that, so far, how many have been vaccinated to date?
So between all the different sources of vaccine, we've vaccinated 32,334 people in Carroll County have been vaccinated.
And we're getting that through a system called Immunet. What's Immunet?
Well, Immunet's basically everybody who vaccinates somebody is required to report the vaccinations into a data system. It's a statewide data system where they report if within 24 hours if I vaccinate 500 people, I have to report into Immunet essentially who those people were, and it has demographic information, tells you what jurisdiction and the ages, and unfortunately it doesn't have that profession category that's part of this prioritization, but we know by age and by jurisdiction who's been vaccinated and actually where they've gotten their vaccination from.
You know, another question from Mary is when will Carroll County be providing vaccines in the county? And this was really the highlight of the discussion, or the crux of the discussion I had with the secretary and his team last night, is that some counties and jurisdictions are receiving a certain amount and others are receiving less. There are some counties with less population than Carroll County that are receiving more doses, and that concerns me. There are some counties that are in proximity to these regional centers in addition to receiving more doses, and that does concern me. So I'm continuing to work with the state in addressing this and working to get additional doses. I think the importance, and I don't know if you've covered this yet, Ed, or not, but in phase 1B, the 75 plus, we vaccinated the majority. We have about 3,300 left in Carroll County available to get vaccinated that are 75 plus. The challenge is now finding where they are. So how can we, let folks know somebody, see somebody, call and get this in? But is that becoming more of a challenge for you at this time?
Well, it is, because some people we've called 6 and 7 times and they haven't returned our calls. And I was just sharing with the commissioner before we got on TV tonight that a person that I knew from was the mother of somebody who was my sister's childhood friend. She called this week and I was able to register her to get vaccinated. And then she called 20 of her other friends who weren't on our list that were in the age group that we're trying to reach, and convince them that it was a good idea to get vaccinated and that it was going to help them all as a community, and we'd be able to try to end this pandemic and get through it. So if you know people who are over the age of 75 that haven't been vaccinated and you can help them get registered, we would encourage you to do that. And that human connection, often just somebody saying, hey, have you gotten the vaccine? And person may say no, or they may say I don't want to, or I'm hesitant to. Well, maybe you could talk to them a little bit about why it's a good idea and what the benefit is to them, and or maybe they'll tell you, well, I just need a ride. And the county's been very good, because we're telling people when we call to register them, do you need help with transportation? And if they do, they just need to call the county's transportation provider, and we'll get them a ride from their house to the vaccination site and back. So either that, or if they're comfortable with you as a neighbor taking them, let's get them vaccinated. So anything that anybody in the community can do to reach out to those people who are over the age of 75, we would greatly appreciate your help.
And that actually segues right into the next question, which I really like, and that is, does the county need any volunteers in helping the clinics? If so, who do you contact? But also, how else can folks volunteer, like you started to talk about?
So the great thing with the volunteers, and I love it. We've had everybody from medical doctors who have come out and given some vaccinations. Our school nurses have been wonderful. We've had a lot of other nurses in the community. Nurse Beth, who worked the testing site for us for weeks, and Robin Gilden, who worked our testing site from the very beginning and has been giving vaccines. I just give a shout out to some of those people, and Mark Vigilati, who used to be a school principal and has essentially been working for us unpaid about 60 hours a week, doing a little bit of everything. It doesn't matter what your skill set is, and we could use help from all kinds of people. Volunteer management is never an easy thing, and as we scale up, if we get more vaccine and we need more people, we'll certainly call on more and more volunteers. There is a thing called Maryland Responds. If you go to the health department's webpage on the right-hand side, there's a link and you can sign up to volunteer. And it doesn't matter what your specific skill set is, anybody can help. And we've had a lot of county employees from Recreation and Parks, a lot of people from the senior centers, since the senior centers have been closed, have been able to chip in and help. And we've just had general community volunteers. So, we need everything from people who just tell people what direction to go and do registration, to people who are giving shots in the arms, to people who are doing the observation when people have gotten their shot, to make sure that they're healthy and good to go when we send them back out the door. So we certainly can use volunteers, and please feel free to sign up at Maryland Responds.
Yeah, and I don't think I can let that go by, because it is a huge shout out to our school nurses and all the volunteers, the doctors, all those that are being engaged in volunteering and working so hard to get doses, get vaccines in people's arms. Carolyn from Sykesville. Why does Carroll County seem, and I think we answered a little bit of this, seem to be so far behind in providing vaccines for 1C groups?
And I'm sorry that it seems like we're behind in 1C, but if I'd have moved into 1C 4 or 5 weeks ago when we were able to, we might only have half of the people who are over 75 that are most at risk vaccinated, and maybe not a large number of our teachers would be vaccinated. We're getting close to the point where we're through 1B, and we want to get to those people who are in that age 65 to 74 group, and we're going to be getting to you all soon. There's another 16,700 people in Carroll County who are in that age group. Some of them have already been vaccinated, but there's probably 10 or 11,000 people in that age group that we need to vaccinate. So we're coming to you all next, and over the next several weeks, we're going to start vaccinating people who are in that age group, and we're going to continue to do that until they're knocked out next.
It was a very surgical approach and a very deliberate decision on focusing on 1B, even when our governor moved into 1C, to get the 75 and over, to get the educators and all those involved with the schools, the bus drivers, as the Board of Education and our school system has opened up, and actually opened up before many of the other surrounding counties. So I applaud a deliberate decision on how to take care of our education community and safeguarding our kids by doing that. It does bring a challenge, because the governor opened up the aperture with 1C, and we are now still finishing up in the 1B category. Are there any plans for using the Ag Center, senior centers, or et cetera for mass vaccination sites?
So I don't want to drill this in too much, but we've been to every corner of the county. The Ag Center wasn't a good site for us. We considered it early on because we want people to, they have to be in observation. We could consider having a drive-through and have people sit in their cars, but it's hard to observe them and whether they're having a medical reaction to the vaccine or not. So we decided we wanted to do it indoors. And we've generally been trying to use every one of the senior centers that we have, but some are smaller than others. And that's why we've stuck to, in Mount Airy, we didn't use the senior center there. We used the middle school, and in Tawnytown, we used the middle school there as well, because those senior centers are smaller. But we've been to the North Carroll Senior Center, the Westminster Senior Center, and the South Carroll Senior Center. And we'll be back at every one of those 5 locations again to try to make sure that we can reach that population that's 65 to 74 as well, and so they don't have to travel as much.
One of the things I also feel we are very blessed, one of those good, bad, ugly. Well, one thing that's very good is the partnership that we have. The partnership with you and all of your team, which are just rock stars, but also LifeBridge and the work that they're doing. And LifeBridge Carroll Hospital is a part of the LifeBridge system. We have weekly calls with the leadership over there, along with us, to do some coordination and understand the distribution of doses and vaccines across Carroll County. One thing that LifeBridge started to do are these mobile vaccine, the vans, and again, trying to work with us, I believe, and I don't know if you've used them yet. Can you talk a little bit about that?
So we've talked with LifeBridge, and we've talked about using the mobile van, but everything that we've wound up coming up with is we've partnered with LifeBridge on a couple of things, and One is LifeBridge is vaccinating our homebound people who are at risk because they still have caregivers coming in who could bring COVID into the house. They don't go out of their house, but they're still at high risk and they're very medically fragile. So LifeBridge has been giving us a couple of nurses to go around, essentially in a car, and we give them vaccine doses. They go out and they vaccinate some people. They come back, get some more doses from at our clinic site, and go out and vaccinate some more people. So we've vaccinated so far 16 people last week, which doesn't seem like a lot, but when you're in Carroll County and you got to drive from house to house as opposed to go into a building and go room to room, it takes a little bit of time to get those done. We have another 18 scheduled this week, and we may knock our list out of homebound people out by the end of next week. And our Citizen Services Department and Social Services and the AIRS Adult Evaluation and Referral Service at the Health Department have been referring those homebound people to us so that we can get them vaccinated. And you know, those little hard to reach people are the most difficult to get to. We've also got a clinic with LifeBridge. We were talking about using the van where there's a concentration of older adults that are primarily over the age of 75 that don't have cars. And we were talking about, well, can we put them on a bus? But there's like 50 or 60 of them there. So we're partnering with LifeBridge and sending over a couple of health department staff and a couple of LifeBridge staff. And we're actually going to set up in their conference room and vaccinate some people on site. So it's you know, in general, the mass vaccination sites are the most efficient way to get to people, but we want to be able to reach people where they are as well if they're not able to get to a vaccination clinic. That we've given everybody at least the opportunity to be vaccinated who are at risk.
I mean, mass vaccination sites in regional centers, like you said, can be very efficient for putting needles in arms. If we're focusing on the priorities and the most vulnerable to getting sick from COVID-19, the 75 plus, it's the ones and twos, and we are going to continue to be deliberate in going after them. That is our priority, along with the rest that are in still 1A and 1B and moving into 1C. The regional centers in Six Flags and M&T Bank and Hagerstown will open up in a couple weeks. We don't travel, and we shouldn't expect the 75 and overs to travel to those regional centers. And you know, I want to continue to be very deliberate in reaching out for them. So I do applaud that partnership with LifeBridge. Cheryl from Westminster asks a very candid question and statement, and I appreciate that. I am in Group 1C, and I'm eligible for COVID vaccine now, and I would like to know the time period in which I can expect to be vaccinated. It has been extremely difficult, time-consuming, and frustrating trying to locate an appointment for this vaccine. Why is this the case? Why is Maryland so far behind other states in regards to vaccinating people who are actively seeking to receive the vaccine?
And I come back to we're working through these priority groups and we're just getting into 1C. And the way that we've done this is we've got people to sign up on our interest list at the health department. And once you know that you're on the interest list, right now I'm encouraging people who are over 75 to call us, because maybe we've called you several times and you haven't called us back, or maybe somehow you thought you signed up and you didn't. So this is the message to the people that are 65 to 74, and it is, we're going through the list now that we've got the interest file, and we're inviting people to come and get vaccinated. It's going to take probably another couple of months to get through everybody that's in 1C. So you're going to have to be a little bit patient with us. If I had more vaccine, we've got the capacity. We could vaccinate 10,000 people a week easily if we had enough vaccine doses. But we're only getting 1,000 first doses a week. So realizing that there's about 11,000 more people out there that are 65 to 74, plus we still have some education and 75 plus to vaccinate. It's going to take a couple of months to get to everybody. And if you're on our list, we're going to call you. If you don't have technology, we're going to email you if you have technology and ask you to sign up. You know, the registration process has been the most painful thing about all this. And as the commissioner said, once you get an appointment, you're in and out, and it's an easy process. So it's, you know, we really wish we had enough vaccine that we could vaccinate everybody who wants it, but we have to deal with limited resources and make the best use of it that we can.
And you're feeding right into a couple of upcoming questions. Donna from Finksburg is asking why are so many Carroll Countyans having to go to Baltimore to get an appointment for a vaccine, and she is in the 1C category. What I'd like you to focus on, Ed, if you can, are what other locations are you encouraging? Because I know about the pharmacies and
Right.
also the regional centers. If you can talk about that.
So we have on the health department's webpage as well, we have all the other resources that are out there. And some people are a lot more motivated to go get vaccinated than others, and they're willing to travel. And that's great. And if it's going to get you vaccinated a few weeks earlier, I don't want to discourage anybody from going to a mass vaccination site. We talk badly enough about that, and we don't think it's focused enough. But it's if you can get vaccinated at Six Flags or at the stadium in Baltimore, that's great. There are a couple local sites here in Carroll County. You can register with LifeBridge. They're vaccinating out of a Randallstown location that's down close to the hospital in Northwest Hospital Center. But there is a CVS in Eldersburg where you could look to register. There are 5 Walgreens, 2 in Westminster, 1 in Finksburg, 1 in Reisterstown, and 1 in Mount Airy, where you can register. And there's the Giant in Westminster are doing vaccinations. So those resources are on our webpage, and hopefully we'll start seeing this get out to providers and additional places as vaccine becomes more and more available.
And it is a current theme in a lot of these questions. One is asking, why do people from Carroll County have to drive to Baltimore County or the city to get vaccinated? We have to drive an hour instead of 15 minutes. We have a hospital, ag center, farm museum that could be used as for vaccine areas. Just again, I want to say reiterate, but share with us the deliberate decision on where you're going to vaccinate the community.
Right, and we're back to the whole thing about the priorities and the people who are most vulnerable and most at risk of spreading the disease and having to work through those first. And I will say that, Commissioner, I referred to mass vaccination centers earlier, and I was talking about our operation because this Friday we've got a clinic scheduled where we're planning on putting 550 people through in 2.5 hours at the Westminster Senior Center. So if I could put 550 people through in 2.5 hours, I could easily do 1,000 there in less than a day. So it's not that we don't have the capacity to do this. There's a lack of supply of vaccine. This is the best that we can do with the limited resource that we're given. We're working through the people who are most vulnerable, and we're going to do our best to get to you when it's your turn.
And again, Gail over in Silver Run, a very candid comment, and I appreciate it because these are also comments that I've shared with the Secretary and you see often. And I know, the commissioners and other leaders are also getting them. But Gail says, when will vaccines be more available? I'm 66. I've been trying since January 25th. I'm on a wait list with the health department and hospital. I contact all pharmacies in the area 3 to 5 times a day with no vaccines available. I've never heard back from the health department if they even got me on the wait list. It seems like mass vaccination sites are going up in areas far from us. It feels like Carroll County is not getting the vaccines we deserve, and vaccines are going unused in other locations. And we talked a little bit about the distribution of vaccines in Carroll County, and again, where they're also going to the regional centers, vaccines going into the hospitals, vaccines going into the pharmacies. There's a lot of the dosage, vaccines going into a lot of different locations. Our health department, we get roughly 1,000.
1,000 doses a week.
1,000 doses a week. So it is very limited, and like you said, if you had 2,000 doses a week, you could vaccinate 2,000 more or 1,000 more people,
Right.
and nothing would get unused. There have been stories of vaccines being unused. Have you found any of your vaccines unused in Carroll County?
Well, our vaccines certainly haven't gone unused, and it's interesting because we actually have a plan where we always, every day, we look at people who are in the priority group, and when we have a vaccine clinic, we make a list of about 10 people, because if you tap into a vial, you've got to use the whole vial or it's no good. So what we do is if we tap into a vial and and somebody has an appointment, we want to make sure everybody who has an appointment gets their shot. So after that person's got their shot, we draw up as many more as we can get out of that vial, and we start making phone calls, and the people come in and we get them vaccinated. So certainly nothing's going to waste here, and I really think that planning wise, statewide, that I don't believe any vaccine's really going to waste, and we're getting the vaccine out within less than, we've actually upped our tempo so that essentially we get vaccine in on a Tuesday, and within 6 or 7 days of having that vaccine, it's all out in somebody's arms. So it's not, we're using it the same week that we get it now.
And the second part of her question is she never got feedback from the health department if she called in. What should she do?
So we actually worked with your staff, Commissioner, to blast emails out to everybody who was on our list. What I would suggest is calling that same call center number, 410-876-4848, and just verifying they have access to our interest files to make sure your name's on the list. And if it's not on there, we'll make sure we get you added. But if it is on there, at least we can verify for you that you are on the list and that we're going to get to you when it's your turn.
Thanks. And Janet from Hampstead, a very similar question to before. Again, sharing some of the frustration, angst, anxiety in dealing with this. Why aren't we getting enough vaccines? It seems only certain privileged people receive it. Why should we have to go outside of our district? Seems unfair that we have to beg, and if we are not knowledgeable on how to maneuver online, we are stuck. And I was very clear about this last night and continue to be clear. These are our priorities. Those that are not tech savvy, those that are in the in-between areas. It's easy to get to the large groups. It's much more difficult to get to the ones and twos. And a lot of folks feel like they are on an island, on their own street. So you've had a clinic up in Hampstead, I believe?
Yes.
Are you scheduled to have another?
We're scheduled to have another clinic up there in 2 weeks. And,
Okay.
And if people don't have the technology, our staff, and as I said, the folks at the senior centers, they know a lot of these people who regularly come to their senior centers, and they're helping us make phone calls. Your Bureau of Aging people are helping us make phone calls and get people scheduled for vaccination clinics. I know it's been very frustrating for the people who are 65 to 74. Maggie Kuntz, who's our PIO, she says to me all the time, it was a really bad year for people to be 74 because, we had to draw the line somewhere, and the line's drawn at 75 plus. So it's, if you're in that 65 to 74-year-old age group, I can't emphasize enough, we're going to be getting to you, but it's going to take probably a good solid month and a half to 2 months to get through the majority of the people who are in that age group as well.
And Kevin from Westminster says exactly the way I feel. In many cases, Maryland is now allowing those age 65 and over to be vaccinated, in addition to those who are in special occupations and health categories. Carroll County has only vaccinated approximately 75% of those in 1B. Is Carroll County receiving its fair share of vaccines? Governor Hogan stated, and I'm going to commit to doing this without glasses, stated that Baltimore City is receiving more than its fair share, which implies that other areas are receiving less than their fair share. Please explain the basis for vaccine distribution.
I think that one's yours.
Yeah, well, partly. And this really was the discussion last night. And I was very frustrated. I'm from Jersey. I'm not going to use bad words, but and I didn't last night either. But I was very direct and pointed in feeling that we were not getting our fair share. And why not? Well, the numbers that the state are using are what's called the Immunet that we talked about just a few minutes ago, and that is the percentages of those that are being vaccinated by jurisdiction, by all the counties along with Baltimore City. Carroll County, in accordance with Immunet, has 32,000 plus vaccinated, and we are at 18% or 18.2%, whereas other counties like Charles County is much lower at, say, 12%. And even though they're getting a regional center there, and more doses, they're still at a lower vaccinated population. So the frustration, and I applaud Senator Reedy for saying it, and I amplified it after, is I feel like we're getting penalized for doing a good job, for being efficient. And, I continue to share that. I agree with you, Kevin. I don't think there's a straighter answer than what I'm sharing with you right now. I'd like to say it's purely on population-based numbers. It is not. It is based on population, along with those that are getting vaccinated, and the standard in the state right now is about 16.5% in a county being vaccinated. So we're actually showing that we're above that being vaccinated across the state.
And Commissioner,
yeah,
I would
please.
just add to this, and I think one of the things that leads to us having a higher percentage of our population vaccinated is because we do have a very high number of healthcare workers that live in our community and may work at hospitals in the city or hospitals elsewhere. We have 11,343 people who are healthcare workers, and they were the first ones off the top that we wanted to get vaccinated because they were dealing with COVID patients every day. So that's a very huge number. So I think from a population standpoint, when you look at the number of healthcare workers here, one of the reasons our number of people who are vaccinated is so high, even looking at our statistics where people have been vaccinated, we had 6,700 people that were vaccinated at other hospitals, and many of those were probably people who are healthcare workers that are working in other jurisdictions and hospitals. So, I mean, if that's what the state's doing to allocate the doses out, one of the reasons we may be getting less is because we just do have such a high number of healthcare workers that live in Carroll County.
And Kevin, you added on, again, I feel like you were preparing my notes for last night's conversation about the state legislators and what are they doing about it to advocate for Carroll County. And if there is a disparity in distribution, what do we need to do to make our needs known? Well, again, Senator Hester and Senator Reedy, along with Delegate Krebs and Delegate Rose, were all on the call last night. They all contributed in the discussion last night, and very deliberate in their approach on sharing what the needs are here in Carroll County. Another thing is that in Annapolis, I know there's an oversight committee or work group that stood up, and Secretary Schrader, or Acting Secretary Schrader, every week provides this work group, this oversight committee, where the state allocations are and where the doses are going across the state. With that, it allows decisions to start being made on if there needs to be reallocation or changes in doses or additional regional centers to be stood up. There's a major concern, if you've been reading the newspaper, about Baltimore City not getting vaccinated. So although they have two regional centers, one of them, the convention center, is focused now on Baltimore City. M&T Bank is focused on the region, but they are trying to put more attention into Baltimore City. I know it may not be the news you want to hear, but it is the decisions that are being made at the state level. I also have a call, and I say we, the county commissioners, have a call with the state every Thursday where all jurisdictions and counties share their frustrations, challenges, again, good practices with the state on how we can do better. And we also talk about the allocation of doses. And I do want to be very clear, because I don't like using the word I. We are working very well. The county commissioners, meeting typically now on Tuesdays and Thursdays on the decision making, and this is also part of that decision making on getting the allocation of doses. I'd like to move on. Paul, and you said 74, but he is 73, and he's trying to pull records for Carroll County. I believe that we have about 12,000 people ages 60 to 100 in the county. That would have everybody done up to phase 1C. And then there's a few question marks and other things. So can you share what the population is that you have?
So again, and these come from our planning department, who who have very good census data numbers that they provided to us. There are 11,348 people who are 75 and over that are in Carroll County, and there are 16,734 people who are 65 to 74. And just additionally, in 1B, when you talk about the people in the education and continuity of government, there's another 7,600 people there. So it's quite a large number when you start adding it up, and we're only getting 1,000 doses at the health department per week. That there's a total of over 30,000 people just in those three categories that we need to reach. And when we start talking about essential manufacturing and start talking about people who work in grocery stores and other essential jobs, there's another 6,000 or so people on top of that we're going to need to vaccinate in 1C.
And Paul also asks a question, which I think is also very important to have a few comments on, are why are teachers getting vaccinated when old people are the ones dying from COVID-19 the most?
So our biggest focus has been on the people who are over 75, but the spread in the community and the potential for spreading it from one person to another is also a very important thing. So as we're going back to school in person, it's not possible for people to socially distance at all times, and there's a lot of interaction between the students and the teachers. The education sector was prioritized, and a lot of thought went into this. And it's not just a local decision that we made as a health department. This was something that was discussed at the federal level and was prioritized there, and also prioritized by the state of Maryland that teachers were in phase 1B. And so they don't hold a higher priority over the people who are over 75, and we've primarily focused on them, but they are very high up there in the priority group and essentially fall above those people who are 65 to 74 in the judgment of everybody who's the public health experts that laid these guidelines out for who we should be vaccinating.
You know, and Ken has asked, again, a similar question about over 65, that over half of Americans over 65 have received at least one shot of COVID-19 vaccines, yet Carroll County still has not begun to vaccinate phase 1C, age 65 and over, at all, even though the governor opened up my phase over a month ago now. And he is 65 and legally disabled, having medical problems. The health department is focused on vaccinating 1A and 1B at this point. Carroll Countyans that are in 1C can still get vaccinated through other places, correct?
Correct. And if
yeah,
you talk
please.
to your physician, and they can get you prioritized potentially with a hospital or whatnot, that's my. If you have underlying health conditions, the thing I've been telling everybody is talk to your physician. Because at some point in time, hopefully some of those physicians' offices are going to get some vaccine, and they may be able to help get you prioritized with a hospital. Actually, the way that this is laid out right now is underlying health conditions, unless you're receiving hospital-based treatments, are not supposed to play a factor in 1A, B, and C. It's trying to take a look at the broad population as a whole. I will say that we've actually, if you look at the statistics for Carroll County, we're not far. We're right in line with where you're saying that where he's saying 50% of the population that's over the age 65, because that would include everybody who's over 75 as well. So if we have a population of about between the 16,700 that are in the 65 to 74 and 11,300, so you add those two together, that's about 28,000. And between both of those age categories of what's been vaccinated so far, there's over 14,000 people that have been vaccinated. So we've vaccinated more than half the people who are over 65. It's just that we focused on the people who are in that higher age range, who are at more risk than the people that are in the 65 to 74.
Okay, Kathy just texted in a question. If you filled out an interest form for Carroll County and have been able to receive the vaccine elsewhere, should you attempt to remove yourself from the interest list? And how does one do that?
that would be actually very helpful to us. And because we're constantly trying to go through the list, and you know, if you don't get yourself off our interest list, we're going to call you 7 or 8 or 9 times trying to reach those couple of people, as the commissioner referred to, that are hard to reach.
Yep.
So if you call our call center at 410-876-4848, I'm getting that number out a lot tonight. Call them and tell them that you need to be removed from the list. We'll take you off, and that makes our life a lot easier, because then we don't have to try to contact you anymore, and you won't get those unsolicited calls from the health department. Well, not unsolicited, but you know, at this point, the call that you don't need because you've already gotten vaccinated. It is helpful for us to know that you've already gotten vaccinated, and we'll take you off the list.
And going back to Kenneth, he asked again, why aren't we using the empty senior centers? That makes absolutely no sense.
Well, we are using the empty senior centers, so
Okay.
I'm surprised people don't know that by now.
Barbara from the Hampstead asked, even though I am 74 and don't seem to fit in a category now being served, I read in state information that people with certain health risks should be served at any time. I have 3 or 4 of those risks, to include diabetes, asthma, and COPD. I am just getting over my second bout of pneumonia this winter. Why can't I be given a shot now? When I called the health department, I was dismissed, and not too politely.
Well, I certainly wouldn't want to hear not too politely, because one of the most important things to me as the health officer here in the county is, and I think in general, our staff are providing outstanding customer service. I'm sorry if somebody didn't have the best of days and didn't come over well in dealing with you, because I expect everybody to be friendly, and we deal with everybody as, you know, it's important to me, regardless of who I'm dealing with, that be a positive experience, and I want everybody to have a positive experience when dealing with our staff at the health department. So I'm sorry about that. I will say that the priority groups, other than hospital-based treatments, do not take into consideration the underlying health conditions. Those really don't get considered until phase 2. And the thing that I've been encouraging people is, again, reach out to your physician, because if your physician feels like you're at risk enough health-wise, I know LifeBridge, in our conversations that we have with them, the commissioner and I talking to them on Thursdays, they'll prioritize people that they think are high risk. So if your doctor can get with the hospital and tell them, hey, I've got this high-risk patient that I need to get vaccinated, they could get you prioritized for vaccination with the hospital system, and that's probably the best route to go. As a local health department, you know, everybody wants to call me and tell me I've got this, and this. Well, we may be good at dealing with the public health as a whole and trying to keep the community healthy, but there's no way that we can evaluate 165,000 people's health conditions, and that's why you have a primary care provider. And I encourage everybody to reach out to your doctor and try to work with them to figure out how you can get prioritized to get vaccinated. And a lot of the physicians are doing a really good job of helping their most fragile patients. We actually worked with Access Carroll on a clinic with their most fragile patients, and you know, that's the appropriate way to make sure we get the people who are most in need, is to have the doctors figure out who their patients are who most seriously need to be vaccinated to keep them from having additional medical risk.
Yeah, and as I shared to you collectively, and also to you, Ed, I am not going to sugarcoat these questions. We need to discuss the good, the bad, and sometimes the ugly, and the unprofessionalism that may come across may not be thought of that way as it was being discussed, but it could have definitely been perceived that way, and how we can continue to do better. Okay, Virginia from Westminster. Why can't my 73-year-old husband with COPD diabetes get the COVID-19 vaccine? We're signed up at every site for Maryland since January. Why are the older seniors being put last? One last question, why are teachers that don't even live in Maryland getting the shot?
Well, let's start with, I think we've already covered that we're focusing on 75 plus. So we're not putting the older people last. And the teachers who don't live in Maryland, they're coming into Maryland, they're interacting with our students, they're interacting with our families. Those families are going to go home, and they're going to be with their parents, they're going to potentially be with their grandparents, and we don't want We don't want the students who are going to school to potentially bring home COVID to their parents or their grandparents and potentially circulate the disease in our community. So the reason the teachers are prioritized is to minimize the spread in our community. And I can tell you that we're specifically focused on people who either live or work here in Carroll County. So if we've got a school teacher that teaches at Manchester Valley High School and they happen to live in Hanover, you know, if they get sick with COVID, they can just as easily spread it to all the kids in the high school as a teacher who happens to live in Westminster. So that's why some of the teachers who are out of state, and the vaccine is a federal asset to a certain extent, and we're really not supposed to be denying people just based on their state of residency. But from a public health standpoint, it certainly makes sense if we're going to vaccinate our teachers who are working in person in our school system to vaccinate the teachers regardless of where they live, because they could potentially make the students sick, whether they live here or whether they live in Hanover.
Yeah, and one more time, I know you addressed it, but also to be clear, Beverly is 65, down South Carroll, asked, is there a way to indicate my risk factors online? I have RA, diabetes, I check every day, and no appointments available anywhere. When should I expect my age group to be vaccinated?
Well, we've talked about when we expect the 65 to 74s to be vaccinated, and that's over the next couple of months. And I'm sorry, I wish I could get to you all faster. If I had more vaccine, I keep saying this over and over again, if I had more vaccine, we could have been through everybody who's 75 and older, and we could be through everybody. You know, if we had an infinite amount of vaccine, we could have gotten through 1A, B, and C a month ago. We don't have that, unfortunately. So, again, the underlying health conditions, work with your physician to get prioritized, and otherwise, you know, within the next couple of months, you can expect to get vaccinated anyway. But if you want to try to get moved up the prioritization list, the thing to do is talk to your doctor.
Okay, Brad from Westminster. With it becoming more and more apparent that booking an appointment for a vaccine is being more akin to a full-time job, people like myself, whom are essential workers spending 35 to 45 hours a week at work, have found it difficult to secure any appointments. In contrast, people who are currently out of work have had not nearly as much trouble. My question is, going forward, what is the government doing, if anything?
So I think that's
to facilitate the vaccinations to frontline and essential workers who have been desperately trying to land an appointment.
So first of all, I will say, as far as the health department's concerned, we're not vaccinating anybody who's out of these priority categories. So if there's somebody that's at home and they're not an essential worker and they're not in a high-risk age category, we're not vaccinating them. We're working very hard to make sure that we stay in these priority categories. So I don't know that I can necessarily say that for the mass vaccination sites at the state level, but we as the health department are targeting our doses to the right people. So we're going to get to the essential workers, which are in the towards the lower end of 1C. The 65 to 74s kind of our higher priority, but within the next month to 5 weeks, maybe 5 or 6 weeks, I'm planning on trying to have clinics at some of our larger manufacturers here in Carroll County, reaching out to those employers and finding out how many people want to get vaccinated. So if we have a large enough number of people at a specific employer, we'll come to them. Or if we have 30 people at this employer and 30 here and 30 there, we'll do a clinic like we do now at the senior centers and essentially invite those people to come and be vaccinated. And it won't be a matter of you'll have to go out and search for an appointment, but we'll ask your employer to send us your first name, last name, email address, and we'll send you an invitation to sign up. Again, unfortunately, we don't have as much vaccine as we would like. It's going to take us a little while to get to these essential workers, but we're going to work with our economic development department and identifying the employers that fit into this category, and we're going to reach out to them and ask them for lists and get people signed up and get them vaccinated as soon as we can. That's the best we can do with the amount of vaccine that we're getting.
This one from Mary Ann in Westminster. It's actually a couple of questions. We have been on the Health Department COVID vaccine registry for nearly 2 months. My husband's 71. Our neighbor received an email from you inviting him to get his vaccine at the senior center tomorrow. Our neighbor is 65. I don't understand the protocol involved here. Can we please be informed on our place on the list? So one is, how is somebody, a neighbor, being asked to get vaccinated? And then two, when somebody gets on the list, how can they find out where they are on the list?
So, you know, we would prefer people not to be calling us constantly, because that takes away from us getting people scheduled and making those phone calls to the hard to reach people. But if you want to call us to just kind of find out where you are on the list, you can call our call center and we can look at where you are in relation to other people. We actually date stamped all the, when we put these in there, in order to try to be fair, we date stamped everybody coming in, and we're going through the list in the order that we have it. We're also trying to, though, when we do go to a specific zip code, we'll target a specific zip code, so that, you know, it doesn't make a lot of sense to hold a clinic in Eldersburg and then have people from Tawnytown drive to Eldersburg. So we may target the 21048 and 21784 zip codes down in that area when we're having a clinic there. So it's not all strictly by when you signed up, but we're trying to go through the list in the order that people signed up, and we're also trying to make sure that we're efficiently trying to keep people as close to home as possible. So we're if you want to give us a call, we'll try to look you up and see where you are on the list as far as you know, the date that you were entered versus where we are with the rest of the people who we've invited. And
you shared that 74, it's a bad year, but also 64 is a rough one too.
That's a really tough one.
So Kathleen, who is 64, from Marysville, do you have any projections that you can make regarding the vaccine will become available to people in priority group 2? And it is very difficult. So go ahead.
Well, and again, that's priority group 2, just because you're 64. If you're otherwise healthy, you may not even fall into phase 2. You might be phase 3, because it's anybody age 16 to 64 with underlying health conditions fall into phase 2. But if you're 16 to 64 and don't have underlying health conditions, you're in phase 3. So we're still having conversations about how that'll roll out. I see that being at least a couple of months down the road for us. I would hope that by the, and the commissioner always says hope's not a plan.
That's right.
But I think as more vaccine manufacturers come online and the vaccine becomes more widely available, we may be able to reach everybody who wants to have a vaccine by sometime this summer. And the president said by May. I don't know that I want to be that optimistic. I always like to under promise and over deliver, as opposed to tell you you're going to get your vaccine by May and then not get to you by June. I think realistically by this summer, anybody who wants to be able to get vaccinated ought to be able to do that, provided we see more vaccine manufacturers coming online, and we're looking forward to more manufacturers coming online.
And you're right. Hope is not a course of action. If it's a priority, you put resources to it, and our government has. And Johnson & Johnson's a great example of a third vaccine that's come online, and they're going to continue, they being the government and the private sector, to work on getting additional vaccines. It is a definite, issue because of the limited doses we're getting both here in Maryland and then also in Carroll County. Michael from Hampstead. I'm 65 and being in the 1C group eligible for COVID vaccine. My concern is for my wife, who is 63, being grouped with younger and likely healthier or less at risk people. Is the county taking this into consideration as it moves to the next phase? I read not too many months ago, those 60 and over were at greater risk of dying. Any thoughts on that?
Well, I mean, the line has to be drawn somewhere, and when this was all evaluated, I could arbitrarily draw the line wherever I want to, but when this was all evaluated, they took a look at, from a public health standpoint and a risk standpoint, the people who were most at risk. And at the federal level and the state level, they decided to draw the line at 1C at the age of 65. We could have just as well decided to draw it at 60. But then the people who were 55 would have said, well, what about me? So it's sometimes these lines get drawn, and that's where they are. And as a policy standpoint, that's where we're headed. If again, the whole thing with the underlying health conditions is we move eventually into phase 2. If the person has underlying health conditions, back to that whole thing about talking to your doctor and making sure that you're prioritized appropriately so that when it's your turn, you can get vaccinated.
Similar to above, Lori Westminster, excuse me, at the beginning of the pandemic, high-risk individuals were considered anyone over 60 years of age. Now that the vaccines are here, 60 to 64-year-olds are treated as if they were 18-year-olds. Would you consider making vaccines available to older age groups first when we are ready to move to that phase for our county?
So we're gonna follow the federal requirements and the state requirements. Technically, right now, I'm not allowed to vaccinate anybody under the age of 65. I'd be violating the agreement with the federal government and the state who give us the vaccine. If the state says that we're in, we can always be. It's kind of like the restrictions for COVID. And the commissioners have always said they're going to go with what the state's requirements are. We can always be more restrictive than what the state is. And in this case, we have been because we want to make sure we hit our most at-risk people first. But I can't broaden it beyond what phase the state is in. And again, I just don't think that, as we're moving down our people who are at highest risk, somebody who's at 65 in general is at more risk than somebody at 64 and 63 and 62. So we've drawn that line somewhere, and those people who are at higher risk we're going to get to first. But we still have this limited availability problem, and if we open it up, we'd be doing the same thing that we're upset with the state about, is not reaching the people who are most at risk and moving on to another population. So I don't see that changing. We are bound by these phases and can't go beyond them. The state might open up the phase 2 tomorrow for all I know, but that doesn't mean that we're going to move on to phase 2 because we still need to hit the people who are at highest risk. So if the state were to change the way that these are laid out and decide that they wanted to prioritize people who are older, we could certainly consider doing that. And we may when we get into phase 2, but we're still a couple months out from that or so we'll have to see where that goes.
And similar, but a bit different here, is Kevin from Westminster, 64 years old, been in cancer treatment for 13 months. I also work as an essential employee and have worked since the pandemic started. I have applied for the vaccine online and have heard nothing. When will it be my turn to get vaccinated?
Well, the essential employees are right behind the 65-year-old to 74-year-old age group, and I'm thinking that we're going to get into some of the essential employees in the neighborhood of about 6 to 8 weeks.
And Joanne, who's 56 from Eldersburg, when will the vaccine be made available to those with health conditions but not receiving hospital care, such as lupus or kidney disease, but not undergoing dialysis? COVID is making these people prisoners in their own homes because they are immune compromised and need to be isolated. Now, you shared a little bit earlier about the importance of talking to your doctor.
Right.
And, I think this is a great case of, getting into a situation where they're having a dialogue with the doctor and finding a solution. Can you?
Again, that's exactly right, Commissioner. And from the public health standpoint, we can't evaluate everybody's specific medical condition. That's why you have a doctor, and you need to talk with them about how you could potentially be prioritized.
So Peg from Mount Airy, and we're going to move on to a little bit about the second dose concerns. She was able to get the first dose of Moderna on 1 March, but a computer glitch would not let her schedule the second dose at the time that she scheduled the first. Now all the appointments are taken. How do I get my second dose at this 28-day time frame when I can't find any open appointments? I was at a CVS pharmacy in Baltimore.
Yeah, so this one's been kind of difficult for us. This is not a health department issue. This is a private pharmacy issue, and we've actually reached out on behalf of some of the some of the people who had difficulty with this and reached out to CVS corporate and been able to get this resolved for somebody. We have a backup plan for them if we don't get it resolved for them. But I would encourage you to give us a call. And actually, if you call the call center number, just ask them to connect you with Maggie Coons, because Maggie has been helping. I'm hoping this is a rare problem. I said we've been dealing with CVS corporate. This is kind of out of the control of the health department's hands, because we get second doses based on the number of first doses that we've administered, and those second doses have to line up with the first doses. And we really don't have the ability to be giving second doses. If you went to Six Flags and you got your first dose, you got to go back to Six Flags. If you went to the CVS in Baltimore, you need to go back to the CVS in Baltimore. What we can help with is potentially navigating with the corporate level to try to make sure that you get your dose where you're supposed to get it. And so give us a call, ask the call center to connect you with Maggie Coons, and we'll try to help you with that. It's, I sometimes bog Maggie down doing her job as our PIO with some of these little issues, but she does like helping people, and she's already dealt with one of these cases, and we have a contact with CVS that we can hopefully try to help her get herself scheduled.
Yeah, and Maggie's just another rock star, on your team. So really, really amazed. Susan, who is 80 over in Hampstead, having a terrible time getting an appointment. So what if I am not able to get an appointment for my second shot of Moderna within 6 weeks from my first vaccine? What is being medically said about the duration of time between the shots?
So first of all, if you're getting your first shot with us, you're not going to have a problem getting an appointment, because we have enough appointments that we've got enough doses that if you got your first dose with us, you're going to get your second dose. If you got it with a private pharmacy or someplace else, we'll try to help you with that. But I know if you got your first dose through the health department, you're not going to have a problem getting your second dose. Those second doses are tied to the first dose allocations. We have enough doses to give to everybody who got their first dose. So it's I hate to say it, but it's a non-issue with us. And if you have difficulty scheduling your second appointment, you can call us. Most of the people who are over 75, and this has caused us to bog down a little bit in some of our clinics. If they don't have computer access, we'll set up an appointment right there on the spot so that they can get their second dose. It's we've already got those doses allocated. Those dates are set. It's going to be 4 weeks after your first appointment. It's Moderna that we're giving. So that really should not be an issue there. I mean, if we want to get into a little bit about, we do have problems where somebody gets sick and can't go out and get their second dose. We do makeup clinics to try to fit those people in if we were the ones who gave them their first vaccine. Again, if you decided to go to Six Flags, don't call me and tell me that you want your second dose from Carroll County, because we don't have it for you. They gave it to Six Flags. But if you're a person that we vaccinated and something happens, and we prefer that everybody stick to that exact 4-week time frame, but medically there are sometimes reasons that people can't, and it's really a 5-day window that we're looking at for people to try to get their second dose of Moderna. But there are recommendations that even if you've gone beyond that, you would still get the second shot. So we're working with people who have specific circumstances, and just because you decided you wanted to travel to New York or you wanted to travel to California or whatever when your second dose was due is not really a good excuse. We really want people who have some kind of unusual need. If you have to postpone your appointment, we'll work with you to get you into a makeup clinic. But we really want people to stick to that 4-week time frame. It's how the vaccine was studied. We know it's effective that way, and that's what we want people to do. So if for instance, if we're offering you an appointment and you know that you're going to be going out of town 4 weeks later, maybe you want to wait a week, or maybe you want to ask for a clinic that's a week out or 2 weeks out, or whatever works for your time schedule. So it's important that we try to stick to that.
So to be clear, the expectations are that when doses are allocated to the health department, or really regardless anywhere, they're going to be getting, that facility or location will be getting 2 doses, one for the first and one for the second.
Correct. And the
what
state,
should be
the
expected?
federal government's been
Okay.
managing that way.
Right.
They automatically, the state automatically orders us second doses based on the first doses we have, and that's for every provider in the state. So
Right.
if you got, regardless of where you got your shot from, your second dose ought to be coming from that provider.
And, an assumption being made with Susan over in Hampstead, because it's not on here, if you did get your first dose at a CVS or somewhere else besides the health department, it's not that you can get the second dose at the health department, but please call, again, Ed said 410-876-4848, and ask specifically for Maggie Kuntz to help navigate you or help you get to the right place, if that's the case, like the question before.
Maggie's gonna hate me tomorrow.
I know, we're gonna be in trouble. So Mary from Tawnytown, how many days after receiving the second vaccine shot are you covered to the extent of the vaccine coverage?
So it's 2 weeks after you've received your second dose when you're considered to be the maximum effectiveness of the vaccine. And unfortunately, and I think I saw a question about this earlier, we're not sure how long that's going to be. We know that it's at least 3 months out that we expect it to be completely effective, and it's going to take some time to figure out for sure how long it's going to be completely effective. We're still studying that, but from 2 weeks after you get your second shot, you're considered to be good. It's so that's where we are on that.
Now, some folks don't like needles, and some folks only want one shot. And right now, Johnson & Johnson's the only one that has a one-shot process. So, Kathy from Westminster, where and when will Johnson & Johnson vaccine be available, and how do we sign up for that specific or particular vaccine?
So the health department's not going to be distributing vaccine based on type. We did get 300 doses, and we scheduled a clinic and we vaccinated people. I mean, we want to be vaccinating as many people as we can, as quickly as we can, in the right people. So as a health department, when we get doses in, we're going to be trying to schedule a clinic within that week. So I can't tell you with us that we have a way that you can navigate specifically getting Johnson & Johnson. I do know that the hospital's interest list does have has the ability for somebody who's in a priority group that they're vaccinating to self-select the vaccine that they want to receive, and the hospital is getting a variety of vaccine. I don't even know if I'm going to get any additional Johnson & Johnson doses.
Right.
We were fortunate enough to get 300 doses. We vaccinated 300 people. It made me happy that we were able to get some more people vaccinated, but I can't promise that the health department's getting any more Johnson & Johnson, if or when. And so if you really specifically want that vaccine, I would suggest going to the LifeBridge site and looking for the opportunity to self-select the vaccine that you want.
Now, just like some people are not so big fans of needles, there's others, they're just not fans of being vaccinated. What if somebody has already had COVID over this past year? Should they still get vaccinated?
So the answer to that is yes. People have been reinfected. That's been documented. I don't know that it's very common. The CDC is saying that we know that people are good for 3 months after they've had COVID. So it's probably safe for people to wait that 3 month period and schedule a vaccine towards the end of that 3 months when they had COVID. But if they've already had COVID, we would still recommend, it's highly recommended, they still get vaccinated. That's going to better protect them.
Okay, so another one is, why shouldn't somebody get vaccinated? Are
So-
there any cases, please?
There are really not a lot of reasons not to get vaccinated. The one thing that we're struggling with the most is we want everybody to get vaccinated, and there are very few reasons not to. There are certain people who are immune compromised that should speak to their physician. But I know just about every cancer patient that I've talked to, their doctor says, get the vaccine. It's better to get the vaccine and not wind up in the hospital and not potentially wind up dying from COVID. So almost all doctors, when we're talking about people who are immune compromised, at least it's been my experience here in Carroll County, have told their patients to go ahead and get it. So talk to your doctor if you're immune compromised or you have some underlying health condition you're concerned about, and your doctor will tell you whether you should be vaccinated or not. The ones that are difficult are people who have anaphylactic reactions, and and could potentially have an adverse reaction to the vaccine. We can't vaccinate them in a mass vaccination clinic. We've been talking to the hospital about some options for how they might be vaccinated through a hospital site, or potentially as providers start to get vaccine, having an allergist available who could work with administering the vaccine would be the way to go. We can't take the risk of potentially having somebody die from an anaphylactic reaction when they have a history of that type of thing with the vaccine. So again, it's back to talk to your doctor, find out what they say, and then we'll have to work out a situation where we can get somebody vaccinated. But just about anybody in the population ought to be able to be vaccinated, and if you have concerns, you should talk to your doctor.
Are there any allergies against this vaccination?
Generally speaking, somebody went through the whole ingredient list at one
Yep.
point in time, and there's really nothing in this vaccine that anybody should have an allergic reaction to. But it's compared to other vaccinations, it's certainly less of a concern than anything else that's out there.
Which actually leads to the next question is, can you get COVID from this vaccine?
No, absolutely not. Scientific fact, you cannot get COVID from the vaccine. I've actually talked to several doctors because I've had people say, well, couldn't I have tested positive because I got the COVID vaccine? And we've had people that, they get the shot one day and the next day they're symptomatic and find out that they actually had COVID the day they were vaccinated. And that's just unfortunate, but you didn't get COVID from the vaccine. That's not scientifically possible. There's plenty of information out on the CDC website. I don't want to get too technical about it, but it talks about, how this vaccine works with blocking the infection, the path of infection. It's a messenger RNA vaccine, which doesn't change your DNA in any way, as people have talked about. It's essentially training your body to fight off the infection. So there is no scientific way that you can get COVID from getting the vaccination.
We vaccinated over 32,000 from Carroll Countyans. You've vaccinated a whole lot. Some of the side effects. What are some of the worries? Should people be taking, pain medicine before they go in and get vaccinated? What should they expect?
So you shouldn't be taking the pain medicine because we want your body to have an immune response to the vaccination, and you're suppressing your body's immune response if you take pain medication. If after the shot you have a reaction, you have to take something. Tylenol is a drug of choice because it doesn't have the same effect as some of the other drugs that are out there. If you can take Tylenol, I know some people have Tylenol allergies, but we prefer you, if you can tolerate, not to take anything, because what it's telling you is if you feel a little bit bad, your body's having that immune response and you're building up antibodies to fight off the virus. So it's the thing that you should expect. And I know I've talked to a lot of people who've gotten vaccinated, and some people just feel a little bit groggy the next day, and some people don't feel any effects at all, but some people it's hit very hard, especially the second shot. But again, I come back to, whenever anybody asks me about this, if you're going to feel bad for a day or two, but you don't wind up seriously ill, the effectiveness of this keeping you out of the hospital and keeping you from dying is 100%. So it's, you want to get, if it makes you feel a little, personally, I got the vaccine, and I would encourage anybody to do it because it's much better than taking a risk of winding up on a ventilator in the hospital or even potentially dying from the virus. And that's the bottom line with this, is we want everybody to be protected and have the opportunity to get back to normal life and doing the things we like to do.
Yeah, and kind of transitioning into that, and we're going to finish up in just a minute because, again, being soldiers that we were one time, we trained to standard, not to time. And although we may have allocated a couple hours, but if we're done, we're done. I want to end off with a couple of things off of the vaccines, but really with COVID-19, and that is the new CDC guidance and guidelines that came out just a couple days ago. It's pretty exciting because parents, grandparents get to hold their grandkids, and people are starting to get back together with the CDC guidelines. You're aware of those guidelines. Can you share either your thoughts on them or?
Well, I actually started off, let off a little bit talking about that and people who are fully vaccinated. It talks about, and people should take a look at the CDC guidelines and read them for themselves, but it talks about 2 people who are fully vaccinated not needing to wear masks and social distance between each other. And what is kind of the uncomfortable situation it's made in our office, and we don't want people to be vaccine shaming anybody, but if you know that I've been vaccinated and you've got my sister's a teacher and she's been vaccinated, I can get together with her and feel comfortable that we're safe and we don't have to worry about that kind of thing. And it's also, if there's somebody who's at a regular level of risk, and now the grandparent, as you're talking about, is vaccinated, the level of risk of them contracting COVID from another person is much lower. So it does give you that opportunity. We all have to think about what our level of risk are, and I know some of the people who talked here about potentially being prisoners in their own home because of their medical conditions and things like that. It's made a huge difference. I personally know a person who's a cancer patient who talked to me, and they talked about the difference this is going to make in their life. They said, well, it's not that I'm going to have a big party, but it could be that, the people that I haven't seen in a long time that are my family members, I'm going to get to see them again now, and I'll feel comfortable. Nobody wants to be the person that if I have terminal cancer, that is the one that gave me COVID and potentially killed me. So it's helpful to those folks. It's helpful to the older adults who are at very high risk, that they are going to be able to engage with family members and things like that. Nobody wants to take undue risks, and taking a look at those guidelines and how it applies to your situation is a good thing to do. The best case scenario is when you got 2 people that are both vaccinated. You can certainly feel fully safe, and as we get to the point where maybe we can get 70 or 80% of our population vaccinated, we can all start to feel pretty safe about doing a lot of the things we had done before. I think really that's kind of the note of hope that I want to leave people with. And while we're making baby steps towards this, and we've got to wear masks and distance and wash your hands and all for another several months, if we can get a good majority of the population vaccinated by summertime, maybe next fall, it'll be like, you remember when we had COVID? I don't remember what it was. I don't remember what it was like without COVID right now. And
that's right.
I want to get back to. I feel like I'm the. I feel like I'm always a person that I've always liked to personally been very, very social and my military friends. You know how the military is. You want to gather with your military friends and family members, and I always like a big gathering. There's an inner 12-year-old in me, even though I'm 55, that still wants to get together with people and play games and have a good time. And I feel like I've been the Grinch for the last year and a half, telling people stay away from each other, don't do this. And we've gone a long way, and we've put a lot of effort into this. We've got a few more months at least of this to put up with, and let's get out on the other side. We don't want to cause ourselves any unnecessary spikes or any unnecessary deaths related to COVID. Take a look at how the guidance fits you and your situation, and to give you a different level of comfort if you've been vaccinated. And I just think that's helpful for people in making their personal decisions about what level of risk they're willing to take.
No, I appreciate it. Those are good closing comments, and I think you're furthest thing from the Grinch. I will share that I do, like the military, feel like the days sometimes are long, but the weeks are flying by. We're in the middle of March, and we've gone through a year of this. We have a long ways still to go. We're navigating through it. I'm hoping that these, time spent in the last hour and a half has been helpful during this session, but it doesn't have to end here. Continue to ask the questions. continue to have the conversations and look out for each other. You know, it's one of those things that we're going to get through this, and I don't want to, you know, beat the dead horse on saying it. We're going to get through this together. We're going to work hard in getting through this together. See something, say something, is what I've always been trying to say. Integrity, doing what's right, whether people are watching or not. Wearing the mask in public areas. It is the law. It's an executive order, regardless of opinions that people may or may not have. It is what is the right thing to do, and that's, you know, something I think very important. I think by wearing this mask and all of us doing this has allowed us to get to where we are and allowed our governor to make the comments he made today, this afternoon, by opening up the restaurants and the retail. It doesn't mean it's gone. It doesn't mean that it's going away tomorrow. It will go away, like Ed, you shared, but I think it's going to go away by us continuing to do what's right. As I have always said, life is good, and I really believe that, and it's going to continue to get better. I applaud all our volunteers. Again, I shared the school nurses, but it's everybody. It's the neighbors and the community rallying and working together, because we couldn't do it without you. And so our volunteers and all the teams that are getting together and partnerships have really been successful to date, and they'll continue to be important as we move forward. So with that said, again, you know, the standard is done, and I think we are finished for this evening. I'm wishing everybody a very healthy and safe evening, and strength and courage to all those that are going through this, and strength and courage to all those first liners that are either in red, blue, and green in serving our communities every day. And with that, this is Commissioner Ed Rothstein and Mr. Ed Singer signing off for tonight. Thank you.
Thanks, Commissioner.